For some reason, my phone or my computer got cut off. But once you have gone through the steps of like the BSP, or whatever task that you're giving your client to get them de-escalated, and to redirect that behavior, um, you will want to repair with them. Pairing is it's so big during sessions. Um, it's so big. And um, you kind of slowly want to get into it. You don't want to go into doing task analysis right away that are on the program, but you want to kind of go into like those high P's just to see if you are able to kind of gain some kind of compliance from your kiddo, um, while they are maintaining a calm body. So um, you figure out, okay, you find out what they want. Um, Towards the end, or to get the behavior to end. So like if your client is tantruming, and while they're tantruming, they say that they want letters. Well, there you go. There you have it. Your kid will calm down for letters. And that's simply stating it. And so we can say, okay, if you want letters, first, and this when we use that pre-Mac principle of first then, you'll say, okay, well, first, touch nose, touch head, touch ears. Once they comply, okay, that's touching nose, that's touching ears, that's touching your head. Um, then you want to give them that reinforcement. Depending on who your client is, what client you have, what's your BSP, you can do like a timer. All right. And you let them know, you give them a warning. All right, it's going to be my turn in 5 seconds. 5, 4, 3, 2, 1. You figure out what they want again. What do you want? And you want to give them in the beginning, you want to give them short access to it. And what you're doing is you're kind of going back into kind of gaining compliance from your kiddo. You are getting them back ready to go into session. You are getting them to the point to where they are able to calm down and be de-escalated. And then with that after observation, you see, okay, like my kiddo has calmed down. I gave them what they wanted, because that giving them what they wanted is kind of going to help them to calm down. It's going to give you the response that you need, to redirect the behavior. When the behavior is happening, you want to make sure that you are as neutral as possible. You want to make sure that your body language is like you yourself. You're calm. You don't want to get excited. You don't want to yell at them. You want to be neutral. You don't want to be too overly excited, because you use your excitement to reinforce, right? As a reward system, a token system. You're like, good job. Da, 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 da. That's excited, and that's a different tone for a different setting. When we are engaging in these behaviors, we need to, or when our kiddos are engaging in those behaviors, we want to make sure that we are calm, we are neutral. That I mean, your voice can be monotone, but you want to make sure your voice is clear, directive as possible. You want to be aware of your precursors, or the precursors to the behaviors, and the antecedent strategies that you're going to put into place. And then you also want to ask questions if you have any questions about the behavior. But the main thing is, before starting session, you want to make sure that you are aware of your client's behavioral support plan. If you are not familiar with it, please speak with the BCBA on the case prior to even beginning session, so that if the behavior does occur, you will know what to do. And if you need help while the behavior is happening, you can for sure and should ask for help.